Hello, my name is Sandra Carroll, and I have for you today a presentation on engineering health care, chronic disease management, and preventable solutions, the integration of ICT reliability and performance day in and day out. Hello, my name is Sandra Carroll, and I have for you today a presentation on engineering health care, chronic disease management, and preventable solutions, the integration of ICT reliability and performance day in and day out. More than half the population of the U.S. suffers from one or more chronic disease, such as diabetes, cancer, heart disease, respiratory disease, and many others. According to the CDC, about 610,000 people die of heart disease in the United States every year. Heart attacks have several major warning signs and symptoms. Chest discomfort, and pain, upper body pain or discomfort in the arms, back, neck, jaw, or upper stomach. In 2010, a cardiovascular, lung, and blood disease accounted for 1,017,000 deaths and 41% of all deaths in the United States. According to the NIH, National Heart, Lung, and Blood Institute, cardiovascular, lung, and blood diseases constitute a large morbidity, mortality, and economic burden on individuals, families, and the nation. Medical science shares a significance in controlling these conditions as well as promoting quality of care. Patients suffering from a multitude of chronic conditions such as comes with cardiovascular disease, including COPD, are most vulnerable and most inclined to gain from consolidation. According to NIH, National Cancer Institute, the number of cancer deaths, cancer mortality, is 171.2%, 100,000 men and women per year, based on 2008 through 2012. In 2016, an estimated 1,685,210 new cases of cancer will be diagnosed in the United States, and 595,690 people will die from the disease. Cancer prevention includes tobacco control programs, education in the scientific community concerning airborne carcinogens, as well as health style education. Unfortunately, barriers to prevention exist in the form of socioeconomic disparities and lack of access to preventive health care. According to the Center for Disease Control and Prevention 2014, 29.1 million people, or 9.3% of the U.S. population, have diabetes. Diabetes can be treated and managed by healthful eating, regular physical activity, and medications to lower blood glucose levels. Diabetes is more than just having high sugar. People do not realize the seriousness of the disease because complications are not noticeable for some time. Complications of diabetes can be heart disease, stroke, blindness, kidney failure, and lower limb amputation. The time demands of guidelines in healthcare are scarce and consuming. It is time to reanalyze healthcare in reference to teamwork, to create a time-sensitive chronic care model consisting of self-care, supportive care, mixed with community resources, advocates for a higher degree of envisioning the team-based chronic care model. Guidelines cannot be created in small increments of time, as the continuity of care must be established and carried forth between patients and care teams. Knowledge by the care team as well as patient information will enhance guidelines on a fluid time scale. It is time to look at care in the form of teamwork. The overlapping of skills such as diagnostic, therapeutic, educational, supportive, problem-solving, and administrative play an important role in a nation's care team. The overlapping of skills such as diagnostic, educational, supportive are all favorable care. Consequences may be more favorably achieved. Framework strategies, a cohesive model for strengthening coordination. According to Peric A.K. Goodman, R.A. Goodman, and H.K. 2011, care management enables a multidisciplinary care team to provide more consistent care for high-risk and rising-risk patient populations while working at top of license. Care management also improves the efficiency of care by automating numerous tasks repeated across a caseload. It employs evidence-based assessments that can auto-generate care plans and recommend mitigations, facilitations, medication reviews, and helps care managers plan their day and prioritize tasks. According to Peric A.K., Goodman R.A., and Gordon C., and Koch H.K. 2011, condition management enables healthcare institutions to manage risk, care quality, and financial performance for patients with low to medium risk chronic diseases or other targeted conditions. This solution offers an initial entry into managing the care of populations and provides visibility to impact prior to entering into risk-bearing agreements. You can identify and act on gaps in compliance with evidence-based care guidelines, develop interventions to close those gaps, and complete closed-loop reporting to determine impact of the interventions and programs. Knowledge Hub as well as Cartogen are applications that work with EHRs, which are electronic health records. These applications allow the physician access to patient records and real-time data while the patient is in the presence of the physician. Now let's take a look at a comparative effectiveness research. CER can support continuing improvements in the delivery system and reduce disparities in healthcare based on race, geography, and other factors, according to Peric A.K., Goodman R., Gordon C., and Koch H.K. 2011. CER is viewed by many in the medical field as limited to corroborating and publicizing testing geared toward a particular illness and treatment. It is possible that CER could have a much greater outcome with the right design. A broader focus is indicated in areas of hazards versus benefits, policy revision, specialty disease targets. This increased focus can bring with it improvements in healthcare delivery and reduction of disparities based on other demographics such as race and geography. Prolific strategies in comparative effectiveness have shown that multidisciplinary passages and system reforms are fundamental in the cost reduction and improvement of quality care. In all parts of care management, compliance and ethics are an important part of health care. Ethics is defined as a set of moral values or principles that govern the conduct of an individual or a group. Privacy is the right of people not to reveal information about themselves. Issues occur when an unauthorized access tries to capture data from the system. Systems must be set up with the strictest of security in order to prevent unwanted attacks by hackers, viruses, and malware. According to George A. Mensah et al., 2012, governments at all levels are increasingly using law in novel ways to prevent chronic diseases, changing the environment to help people make healthy choices and avoid unhealthy behaviors that contribute to chronic disease. Legal strategies can help support environmental changes to improve health.
Chronic diseases such as heart disease, cancer, and diabetes are the leading causes of death and disability in the United States. Chronic diseases account for 70% of all deaths in the U.S. and cause major limitations in daily living for almost 1 out of 10 Americans, or about 25 million people. Chronic diseases are often related to modifiable health risk behaviors that include lack of physical activity, poor nutrition, tobacco use, and excessive alcohol consumption. Laws have played an important role in the healthcare field, although fully functional laws have not yet been fully attributed and recognized. The diagram in this slide shows the different portions of the mHealth ecosystem. According to Hameen S. in 2015, adherence to treatment, and specifically adherence to treatment of chronic disease, is a critical link that connects the promise of mHealth to the ultimate goal of improved clinical outcomes. Though adherence tools were generally accepted, patients and providers documented a number of negative elements and perceptions. Patients' primary concerns included dependence on professional supervision, unnecessary medicalization, and undue anxiety in the technical field and if the technical field failed. mHealth included any mobile device or service, such as mobile phones, SMS, smartphones, personal digital assistants, and devices that work on wireless technology or Bluetooth compatible devices. These devices and services allow patients to monitor their health, access health information, and communicate with their healthcare provider without requiring a wired connection to the internet. Impact of chronic disease management and solutions on healthcare education. Among the most studied evidence-based programs, the Chronic Disease Self-Management Program, CDS-MP, has shown to help participants improve their health behaviors, health outcomes, and reduce healthcare utilization. This is according to Sannam, AHN et al. 2013. Findings emphasize the value of public health tertiary prevention, interventions, and the need for policies to support widespread adoption of CDS-MP. Chronic disease may be the most expensive among healthcare treatment costs, but it is also the more treatable by educating the masses across their lifespan and encouraging healthy lifestyles that will prevent the onslaught of chronic disease. Early detection efforts include no smoking, diet and exercise, healthy eating habits, regular healthcare screenings, early diagnosis and treatment of progressive disease such as arthritis. Unfortunately, our healthcare system has had past focus primarily on the treatment of disease as opposed to the treatment of disease. In the effort to reduce chronic disease and promote wellness, it is essential to have a coordinated and strategic approach to prevention that promotes healthy lifestyle choices and utilizes early detection and diagnosis. The function of protecting and developing health must rank even above that of restoring it when it is impaired. And that statement was by Hippocrates.
Stop the global epidemic of chronic disease was the challenge laid down to global leaders by the World Health Organization today.
Well, without action over the next 10 years, at least 350 million people will die from chronic diseases, from heart disease, from stroke, from cancer, and from diabetes. And many of these deaths will occur prematurely. And this will cause untold suffering to individuals, to families, to communities, and countries.
The new report, Preventing Chronic Disease a Vital Investment, shows the scale of the problem is massive, with chronic diseases such as heart disease, stroke and cancer responsible for 60% of global deaths every year. And staggeringly, nearly half of these deaths are occurring prematurely in the under 70-year-olds. The research identifies that nearly 80% of chronic disease-related deaths occur in low to middle-income countries, challenging common misconceptions that chronic diseases are mainly an issue for rich people in rich countries. At just 13 years old, Mariam John from the United Republic of Tanzania is suffering from bone cancer. Coming from one of the world's poorest countries means her access to medical treatment and facilities is extremely limited, and that makes her future very uncertain.
Chronic diseases are largely preventable. The real tragedy is that more hasn't been done to prevent chronic diseases. At least 80% of heart disease, of stroke and diabetes, and 40% of all cancers can be prevented by encouraging healthier eating habits, more physical activity, and above all, by discouraging tobacco use.
Mallory Twalib, living in a small village at the base of Mount Kilimanjaro, United Republic of Tanzania, a low-income country, has been identified by health workers as being obese at just 5 years old. Obesity is a problem too often identified only with high-income countries, but in reality it is a growing problem of low and middle-income countries, where increasingly people like Mallory have unhealthy diets and are less physically active. Critically, obesity is one of the lead risk factors of chronic disease. In Mallory's case, fortunately, village health workers have intervened, encouraging him to eat less and play more. The World Health Organization calls on the global community to recognize that chronic diseases are now a global epidemic, and without immediate action, they will take more than 350 million lives in the next 10 years.
In this slide, we will view a 3-minute video news release on the global epidemic of chronic disease. This video is presented from the World Health Organization on the subject of chronic disease and health promotion. In this slide, you'll see several examples of data capture tools used in medical technology. Data capture tools and technologies, access to complete and accurate data, as well as IT services in the right place at the right time, can enable optimal workflow by the capture and the sharing of integral data that is relevant to the point of care. Care teams can utilize technology to promote organized boundaries and systematized operations to augment the healthcare experience for patient and providers at every level. Empowering patients with the ability to understand their healthcare needs to efficiently operate technical tools at their disposal, such as computers, cell phones, tablets, and other advanced mobility items, will improve their health and give them access to better healthcare programs, as well as the means to educate in self-care. Usability and system design for patients and providers. Health IT systems are driven by key elements in utilizing IT systems to improve chronic disease management. Testing is of utmost importance. One such project has been successful in treating patients with CDM, telehealth networking, which enables physicians to receive input concerning clinical practices in the treatment of CDM. The telehealth network enables physicians to educate one another. Telehealth can also be used to provide education to patients. Interactive voice response system can be used by patients in the home environment by use of telephone. A computer generates feedback for the patient. The AHRQ funded projects listed below are measuring the impact of health IT on chronic care quality, safety, efficiency, and managing patients with chronic disease. Statewide implementation of electronic health records, showing health information value in the community network, evaluating smart forms, and quality dashboard in an EHR. Project Eco Extension for Community Healthcare Outcomes, AHRQ 2016. Health IT solutions need to be tailored for the end user to improve usability and avoid information overload. Health IT can enable opportunities for remote patient management, patient education, and provider information. Sharing for patients with chronic conditions, according to AHRQ 2016. Through its four distinct but interdependent fundamental goals, the HHS, Health and Human Services Strategic Framework on Multiple Chronic Conditions, helps to fill a major gap. It provides for the first time a cohesive model for strengthening coordination and effectiveness of efforts to improve health and quality of life for people with such conditions. And this is by Parekh A.K. Goodman, R.A. Gordon, C. Coates, H&K, and the HHS Integracy Work Group of Multiple Chronic Conditions, 2011. Without this technology interventions, people will continue to suffer and die from lack of appropriate health care. Whether here in America or in third world countries, the fact is that many people do not receive the health care necessary to enable them to daily function in daily life in a productive manner. We, the people, do deserve better. In a study by Truls Osby et al., 2005, there were applied guideline recommendations for 10 common chronic diseases to a panel of 2,500 primary care patients with an age-sex distribution and chronic disease prevalence similar to those of the general population, and estimated the minimum physician time required to deliver high-quality care. The conclusion of this study: current practice guidelines for only 10 chronic illnesses require more time than primary care physicians have available for patient care overall. With the success of treatment and preventive guidelines, the continuum of care falls to a team of care providers and relieving the financial burden on society. Many specialists are reorienting their services toward conventional health care services performed by the primary care physician, combining a team effort in the treatment of patients with severe illness. According to the CMSA, Case Management Society of America, 2010, the 1995 Standards of Practice were recognized as an anticipated tool that case management would utilize with every case. They were used as a guideline to move case management practice to excellence. Then in 2008, with the establishment of the Affordable Care Act, healthcare plans were supposed to be designed to improve performance and create lower-cost healthcare initiatives. Americans, unfortunately, are still waiting on the lower cost. It is imperative that the capacity to design legal framework tools be enhanced in order to prevent chronic disease and disability. Researchers must find a venue for legal theories and methods to be applied. A new day and age has appeared on the healthcare horizon in the form of mobile technologies. Adherence to the technical guidance platforms will increase feasibility and use. mHealth tools have proven vital in facilitating adherence protocol. mHealth has the potential for huge impact on chronic disease management as delivery services impact patient outcomes and become measured as easy use because of people's normal inclusion of technical instruments as part of their everyday lifestyle. After all, how often do you see a person who doesn't have a cell phone, a tablet, or a laptop with them at all times? Despite the popularity of technology used to generate e-health, the reports of impacts are diverse. One of the most criticized elements of mHealth is the way in which delivery is not accepted in a global community. However, no new trials have been reported in recent years, so it is plausible that new innovations and public comprehension has been seriously overlooked. It just seems evident that with education and social support and health policies and environments, people can and will take charge of their health. Strategies are needed to facilitate and support individual responsibility and behavior change at schools and workplaces and in faith communities, and medical-based settings. According to the Power of Prevention 2009, without concerted strategic intervention, chronic diseases and their risk factors can be expected to cause more harm and be more costly to society. We cannot effectively address escalating health costs without addressing the problem of chronic disease. In conclusion, it is fair to state that design and engineering technology in a public health strategy has developed needed resources for the prevention, detection, and treatment in chronic disease management and solutions. It takes a combination of policymakers, employers, and healthcare leaders to unite in best practice policies for transforming communities by increasing education and awareness of ICT usability in the healthcare field. Unless reformed systems are given the value deserved, they are unlikely to serve as an adequate means to increase healthcare delivery at a lower cost. Lack of delivery of these reforms in healthcare engineering will allow the continuance of major gaps in the system's healthcare delivery and management of chronic disease, as well as lowering overall costs and creating preventable solutions to chronic disease.